This is William, my husband. He's agreed to be my patient for the day. We've already gone over a brief health history and his medication list. He's not on any medications. I've washed my hands and I've obtained a set of vitals on him. First, I'm going to assess his arms and hands, skin integrity, noting any bruising or lesions, scaling, rashes, cuts, nothing apparent. His features appear symmetrical. Next, I am going to palpate his shoulders and his arms. I'm going to note his tone. Tone appears appropriate. I'm going to check his radial pulses. Radial pulses are symmetrical, even, and strong. Next, I'm going to check his brachial pulses. Brachial pulses are symmetrical, even, and strong. I'm going to check his range of motions. I'm going to have him raise his arms up and down and back and forward. Range of motion is symmetrical and appropriate. Next, I'm going to check his muscle tone and strength. Push my hands up. Pull my hands down. No deficits noted. Strength is even and appropriate. I'm going to check his capillary reflexes on either side. Capillary reflexes are less than 2 seconds. I'm going to inspect his head and facial features. Facial features are aligned. His head is midline. Hair appears clean and evenly distributed. No signs of bugs or anything like that. I'm going to palpate his head, noting any lumps. Any pain anywhere?
No.
I'm going to palpate his occipital, noting any pain.
No.
Next, I am going to, I inspected his facial features and his eyes, his nose, his mouth, his ears are symmetrical and appropriately aligned. I'm going to check his sensation. Please close your eyes. Tell me where I touch you.
Forehead. Cheek. Chin.
I'm going to then check his facial nerves. I'm going to have you open your eyes, raise your eyebrows and relax, smile and relax, grimace and relax, bare your teeth and relax. Facial nerves are appropriate. Next, I am going to check his eyes. Can you please close your eyes? Eyelids are symmetrical, well appearing, no crusting noted in the eyebrows or the eyelashes, no bruising, no swelling. I'm going to, his lacrimal ducts don't have any drainage. You can keep your eyes open. His pupils appear equal and round. His eyes are appropriately placed. Conjunctiva is pink. Sclera appears white. Next, I'm going to check his pupils. I'm going to have him look right at me. I'm going to check his peripheral and I'm going to check both of direct and consensual reflexes. Both are present. I'm going to then check his corneal light reflex. I'm going to get very close to you and put my hand on your forehead and follow it in. Noting the back of his eye and the blood vessels. No apparent obstruction or abnormalities. Pupils are round, reactive, and dilated appropriately. Next, I am going to check his peripheral reflex. Look straight at me. Tell me when you see my hands.
There.
Okay, peripheral vision intact. Next, I am going to check his neck. Neck appears aligned, tracheal alignment appears normal, respiratory effort appears normal, no notation of accessory muscle uses. I'm also going to check his cardinal field of gaze. Look right at my finger, don't move your head. My finger. Gaze appears appropriate. Respiratory effort appears appropriate. Alignment of the trachea is appropriate. No accessory muscle use. I am now going to auscultate his carotid arteries using my bell, and I'm going to be listening for any bruits on either side. No signs of any bruise. I am next going to palpate his carotid arteries one at a time. Carotid arteries are symmetrical, even, and strong. I'm going to now finish checking his lymph nodes. I'm going to check his tonsillary lymph nodes, his submental lymph nodes, his submandibular lymph nodes, anterior cervical, posterior cervical, and the subclavicular. I'm then going to check his skin turgor near the clavicle. No tenting noted.